Hello everyone. This presentation is on Bai Hu Tang, also called White Tiger Decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Bai Hu Tang is classified under clear heat. A representative pattern is high-level excess heat with high fever, profuse sweating, intense thirst, and a surging forceful pulse. Important ingredients include Shigao, Jai Mu, Jing Mai, Gan Kao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 47-year-old woman with acute febrile illness after medical evaluation, history of hypothyroidism, and hypertension. The current medicines are levothyroxine, hydrochlorothiazide, metformin. This case gives a plausible reason to consider Bai Hu Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Shigao plus levothyroxine. The mechanism is mineral-rich products can bind some oral medicines in the gut and reduce absorption. The clinical significance is clinically relevant for levothyroxine because consistent absorption is important. My management plan is separate levothyroxine from mineral-containing herbs by several hours. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Gan Kao plus hydrochlorothiazide. The mechanism is licorice may lower potassium and raise blood pressure. Thiazides can also lower potassium. The clinical significance is moderate and potentially serious if hypokalemia develops. My management plan is monitor potassium and blood pressure and avoid prolonged use. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Jai Mu plus glucose-lowering therapy. The mechanism is an amarina has glucose-lowering signals in experimental studies, so an additive effect is possible. The clinical significance is evidence is limited, usually low to moderate. My management plan is monitor glucose during use in patients taking diabetes medicines. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Bai Hu Tang may be reasonable when the patient's presentation matches high-level excess heat with high fever, profuse sweating, intense thirst, and a surging forceful pulse. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.